benefits of tobacco cessation. The learning objectives are that by completion of this activity, participants will be able to list the conditions which are less likely to develop as a result of smoking cessation. Overall, smokers who stop smoking will live longer, are less likely to develop tobacco-related disease, and are less likely to develop complications or worsening of tobacco-related diseases that have already developed. The extent of the individual's benefit from tobacco cessation depends on how much they've smoked before quitting, both the intensity of prior tobacco use and the number of years of prior tobacco use. Smoking cessation confers a mortality benefit. People will live longer. First and foremost, stopping smoking at younger ages, especially before the age of 40, has an even greater effect on reducing premature mortality. But even for smokers who quit after age 80, they're likely to live longer than patients who continue to smoke. We're going to go over the several main tobacco-related diseases and the effect of tobacco cessation on either the development or the progression of those diseases. For cardiovascular disease, smoking cessation is associated with a substantial reduction in the risk of cardiovascular events, including myocardial infarction, sudden cardiac death, and stroke. People who have symptomatic peripheral artery disease are less likely to progress in the pain of their condition, and people who have had a stroke in the past are less likely to have another stroke. Malignancy. Tobacco cessation is associated with a reduced risk of developing a tobacco-related cancer, and there's a possibility that people who already have a cancer are less likely to develop a second cancer if they stop smoking. Pulmonary disease. Smoking cessation reduces the accelerated decline of lung function in smokers and reduces the risk of the incidence of COPD. People with early COPD experience improvement in their cough and sputum production within the first year of quitting. And people with COPD are less likely to have exacerbations of COPD if they quit smoking. Diabetes. Quitting smoking reduces the overall risk of diabetes, but that's only seen several years after quitting. Osteoporosis and hip fracture. Smoking cessation can prevent the onset of osteoporosis by reversing the loss of bone mineral density. And smoking cessation also decreases the elevated risk of hip fracture for those who smoke by approximately 30%, and this benefit occurs 10 years after quitting. For a pregnant woman, quitting smoking during pregnancy leads to improved both fetal and maternal outcomes. Peptic ulcer disease. Smoking cessation reduces the risk of developing peptic ulcer disease, and it also helps with the healing. It accelerates the rate of healing in people with peptic ulcer disease. Periodontal disease. Smoking cessation results in a decline in the risk of periodontitis, and the decline increases with the number of years that the person has been abstinent. And finally, postoperative complications. Smoking cessation prior to a surgery can prevent postoperative complications, including delayed wound healing and pulmonary complications. And the longer the period of abstinence prior to the surgery, the lower the rate of postoperative complications.